Hello friends, today we will discuss another important topic, ADHD. This case could be given in history station or in development assessment station. The first component of ADHD is hyperactivity. They are very hyperactive in nature, fidgety, and they cannot able to complete a task in time, and they cannot able to sit in a place. They are noisy in nature. The second component is impulsivity. They used to interrupt the conversation or and game. They are much more talkative rather than good listener. They cannot wait for their turn and find difficulty in taking turns. The third component is inattention. Their attention span is very short, their concentration is very poor, they are getting easily distracted. They are forgetful in nature and they avoid activities that requires mental task. Duration should be at least 6 months and it should be manifested at least two places like at home or at school. They are very commonly associated with learning disability, epilepsy. Other association, tics, anxiety, depression, hearing or visual problem, and autistic spectrum disorders. Speech, they are talkative in nature and noisy. In school, the academics, they are much more prone to have silly mistakes. They dislike homework and tasks that require deep thinking or mental activity. They start answering the question before it completed and constantly poorer academic success. They are very poor in mathematics as well as reading skill. Socially, they are very overwhelmed, impatient and frustrated. Diet, they like the food that contains high sugar. They dislike nutritious foods like vegetables. Sleep, they are late in bedtime, poor sleep quality. Other important history to be explored like the complete development history, antenatal history of smoking, intake of alcohol, drugs, natal history of HIE, hypoglycemia, cerebral palsy, school admission, neonatal jaundice, family history of ADHD, autism, and social history of family background, domestic violence, physical or emotional trauma. Diagnosis is mainly made by ICD-10 or DSM-5 criteria, made by specialist child psychiatrist or a community pediatrician or appropriately qualified healthcare professional with training and expertise in the diagnosis of ADHD. Duration at least 6 months, started before 12 years of age, and at least manifested in two different settings, example at school or at home. Management is multidisciplinary, led by clinical psychologist, school psychologist and community pediatrician. Pharmacotherapy available, all the stimulant drugs are used to stimulate the inhibitory centers like methylphenidate, lisdexamfetamine, dexamphetamine, atomoxetine, guanfacine. Non-pharmacological management are psychoeducation, cognitive behavioral therapy or behavioral therapy, parent training, education programs, social skill training, CBT, others like special diets and supplements with omega-3, omega-6 fatty acids. Others. Social worker involvement is very important to provide financial support, occupational therapist. School involvement is very important for the preparation of education healthcare plan, teaching in small groups or arrangement of special school. Thank you.